So please go ahead and ask your questions. Okay, one at a time. All right, we go from the side. And please try and be as brief as you can. Name who you are and ask your question.
Namita Bhandare, formerly fat person. And thank you, Dr. Susie Orbach. I agree with you that an industry which has a 97% failure rate really needs to be shut down. And I've been to every diet doctor in town, but because it was drilled into my head, obesity is now being regarded as a health issue. But it was always, in my 30s, seen as a beauty issue. And I thought I look okay. And I was okay with being fat. And I went to every fat doctor in town, and nothing happened. So I thank you for your anti-perspective in that sense. And Dr. Mukherjee, my question specifically to you would be, what is the responsibility of your industry in going on perpetuating this myth that obesity is a beauty issue when it is in fact a health issue?
I don't think we said it's a beauty issue at any point in this discussion. It is a health issue. Health is much more than body weight. Yet achieving the ideal body weight is the first step to achieving good health. That is largely the whole thing. Well, medically, there are a lot of parameters. There is BMI, there is waist circumference, there is height-weight charts. So there are these reference points, and beyond which one realizes that one puts on weight and then precipitates medical conditions like diabetes and heart disease in our country. So this is what it is. It's more about health. It's not really about beauty. But yes, when you lose weight, you also look good, which is an added benefit.
Yeah.
I'd like to just come in. Is this mic working? Yes. I'd just like to come in on the issue of the BMI, because I think it's a totally preposterous issue. And on a reanalysis by Catherine Flegel, who works at CDC, the Center for Disease Control in Washington, she's reanalyzed the whole world-class, all of the data, and has discovered that the most safe weight, if you want to put it in those terms, is to be in the overweight category at 27.5. So it's a completely spurious measure, and it needs to be really thrown out. We need to contest it, and we need really to understand why the medical journals, the pharmaceutical companies, and the whole industry, Obesity Inc., is involved in perpetuating a myth that is not accurate. The kinds of really large-scale disabling forms of obesity may be something we have to be thinking about. But for the vast majority of people who are wandering around worrying that they're fat and involving themselves in extraordinary treatments, they are doing nothing but undermining their own capacity to look after themselves. And it's an outrage that they're being put through this.
So I totally agree with her that BMI is an easy method to manage your obesity, but like we see it in India, and like Arya said, waist is more significant for the Indians. So waist, the ratios, but we don't have yet that index to measure obesity. And until such a point of time, I think BMI is the relatively simple one. Yes, you had a question, please.
Hi, my name is Janela Flam, and I'm an expert in what I call pleasurable weight loss. And Susie, I wanted to thank you personally. I read one of your books when I was 18 and in the thick of an eating disorder, and it was the first time I'd ever heard of the psychology of it. And almost 20 years later, I am with you in sharing these ideas, so thank you very much. My question is about body image, and one of the aspects of the biochemistry of weight loss, as you mentioned, Arya, is the stress response has a huge amount to do with it. And body image, bad body image, creates a stress response. And it can be almost like an autoimmune disease where I hate my body and it just grows and grows and grows. And I really liked your top 3 reasons for obesity. I was very relieved with them. Thank you. So I'm curious to all of you, Susie, but all of you, about how do we help people improve their body image? Weight aside for a second.
Well, I think there are a lot of initiatives going on around that I know, that I'm involved in. I'm part of a group called Endangered Bodies, and we exist in several countries. And there are a lot of initiatives like challenging the fashion industry, teaching people how to pattern cut so clothes can come in all different sizes. I'm working with the British government very closely to help new mums not pass on their eating problems to their babies, so that they don't start having C-sections at 8 months, which is the new fashion, in some fantasy that they won't get fat, as though you're never supposed to be marked by having had a baby, and as though a post-pregnancy body is per se fat. So I think that's an absolutely key area to work, is with new mums, taking on all of visual culture, so that I'm not one for labeling, but so that we get much more variety within visual culture, and helping young people not simply to decode the 200 retouching that happens on every single image that is on every single page of a magazine, let alone what's on Facebook and everything else, but getting them to create their own cultural forms where they actually talk and try to get through. And I mean, I've been working with a lot of young people where they talk about the kind of tyranny that they're living with, and the kind of world where they'd like to have their body be something that just exists for them and is a source of pleasure rather than absolute sorrow and anguish. So I think there are many different interventions we have to make. And wherever we are, we have to go bang on the doors, and we have to insist that we see a much fuller representation of people as they really are.
Okay, Dr. Arya, would you like to get on?
Yeah, I'd just like to, we tell our patients, you can't measure health by stepping on a scale. It's a number that can guide you, in certain ways in a clinical context, but you cannot step on a scale and decide based on the number you see there whether you're healthy or not. One of the key treatment options that we offer to patients, and in fact a lot of patients in our clinic actually get that, our workshops where they work on self-esteem and body image, which just came up, which is one of the key drivers to everything from unrealistic weight loss expectations to chasing after ideal weights, which I don't even know what that number actually means. In fact, we have more or less abandoned the whole concept of BMI. In fact, the Edmonton Obesity Staging System is something that we came up with because we found that BMI was simply not useful in a clinical context. So I think what you're seeing is an evolution of the field that is happening quite rapidly, and hopefully some of the mistakes that have clearly been made in this field, in the West, will not be repeated in this country. Unfortunately, as I said in my introductory remarks, we are still not teaching obesity to health professionals. So the question is, where do you even go for help to start dealing with any of these issues?
So I'm going to take the prerogative of the chair. Could you just name yourself and keep your question as brief as possible, please? Thank you. So that we can fit in more and more questions, in the session. We've got limited time.
Hello. Can you hear me?
Yes, please.
My name is Pawan Malhotra. It's for all the panelists. In fact, the contradictions on the panel remind me of Mark Twain's quote, "Beware of health articles, you might die of misprint." So I just wondered, there's a sudden blitzkrieg of books on health and articles, and they're using celebrity as the brand ambassador, and each contradicting the other. So whom to believe? But Anjali, I am aware of, but when there are others, and it's become a fashion to come now go to Dr. Lagdawala.
So where's the question here?
Question is whom to believe? There's so many books coming.
Okay, so we get your point. Next, please. Yeah.
Well, the last thing the world needs is another diet book.
Yes. My name is Aditya Gambhir. Hi. My question, very simply in general to the panel, is this from a feminist standpoint, especially the point that Dr. Orbach was talking about how every image is touched up to look to sort of project a certain body type as being the ideal body type. So I can't help but notice that even when this lady asked a question and Dr. Mukherjee was replying, in the end she did fit in that point about how when you slim down you do look better, so therefore that's an added benefit. Who says when you slim down you look better? I say somebody may feel that they look better when they are when they have slightly more weight. So I'm just saying that right now we all of the panelists concur that it's a health issue, not a appearance issue. But my question is, out there in the world, out there in the market, in the advertisements, etc., obesity and weight has become more of a appearance issue. And what is the take of the panelists on that? And how do you stop people from getting it into the minds of, especially, you find the fairer sex more sort of ingrained with this sort of mentality in that sense. So how do you counter that, and is that right at all?
So beauty lies in the eyes of the beholder. We can't do too much about that. But I think the government, the stakeholders all need to start moving into identifying, like Anjali said, put price tags on diet and various other things. Only then we'll probably get the answers. Yeah, thank you.
So mine is not a question, but probably a suggestion. The panelists mentioned that there should be more taxes on the junk foods, etc. I find that I am a telecom expert, and I have traveled all over the country in the villages where the overweight percentage is very low as compared to the cities. And mostly I find the people, when they get married, they have the tendency to get more weight. So my suggestion would be, instead of putting tax on the fake food, probably you should give some concessions in the income tax to the bracket of people who are absolutely up to the underweight.
Yes, please. So we have a lot of corporates who actually do that. They give more incentives to people who are below a certain BMI. Yes, please. I'll get.
Hi, I'm Dr. Veena Agarwal. Just a few quick rebuttals to what everybody's been saying about it being a health issue versus a beauty issue. Even a beauty issue is a health issue, because according to the WHO definition, health is not mere absence of disease. It's a state of mental, physical, spiritual, economic well-being.
Yes.
So even if it is a perception of a beauty issue, it is a health issue. So if I perceive it as a beauty issue, I am unhealthy. I have to perceive it in that context. Secondly, about your observation that we don't have curriculums where we teach doctors, how would you suggest we bring in those curriculums in our system of medicine? Are there courses that we can adapt to our, offer to our doctors here, short-term courses, long-term courses? Thirdly, what is Anjali, what is your take on the Ayurvedic principles towards weight loss?
Yes.
And fourth question is, what are the regulatory mechanisms we can put in for the diet clinics that we have, mushrooming of diet clinics at every nook and corner?
Right.
So allow me to start with the curriculum question, because this is something that we are, of course, very interested in. Obesity is complicated. The physiology of how the body regulates things like appetite, reward, how stress levels affect your body weight, your cravings, your food eating behaviors, and what happens when you start losing weight. I mean, those are things that we understand very well, but we don't teach. And it is not difficult to construct that curriculum. It is not difficult to identify what it is, what the elements of that curriculum would be. One of the problems we have is that we don't have enough teachers to actually teach that curriculum. And I think that's one of the major challenges that we have, because we have not been training health professionals across the boards, and this is not just doctors. We have just not been training health professionals to address obesity in the same way that you would address other conditions like diabetes or hypertension or other problems that can cause health. Now, this is not to say that everybody who has excess weight is sick and needs to see a doctor. I'm talking specifically about those individuals who have weight-related health issues.
Right. About Ayurveda, that you questioned, I think the West also needs to be exposed to Ayurveda, just the way they got exposed to yoga, and we started following it more just because it came from the West, which originally existed in our country. They need to be exposed to Ayurveda, because that speaks about the concept of Vata, Pitta, Kapha, that's constitutional difference between one body type and the other, and Ahar Vihar, which is your diet, is very, very important for control of disease. Here we're just talking about disease and not really just the beauty aspects. It's very important to eat right. Even there's a lot of research which says that eating a lesser amount of calories is anti-aging in nature. So there's a lot of research that is going on in this field. So Ayurveda needs
just
to
a brief comment on her thing on regulation, if you can, because we've just got 2 more questions. We don't have too much
I'm
time.
not a regulation person as such, because I'm more of a nutritionist who's into hardcore treatment of obesity. So your question was that these clinics should not mushroom or something like that.
Is there
right?
some regulation that can come in to regulate these clinics?
Well, I think everyone should follow what is right, and following the right diet, exercising regularly. I mean, there has to be a consciousness that comes in within all the centers, that there has to be a certain healthy way to achieve ideal body
So we
weight.
don't have a regulation, but
Yeah,
I think I agree with you.
Yes,
We
I'm not
should get a
regulation
regulation.
person. Yes, we should get it.
Yes, please.
Dr. Seema Sharma, clinical neuropsychologist and psychotherapist. Very much agree with you, Susie, there. And my query or an observation is that when we deal with people who are obese, why is it that we only look more into biology, less into psychology? Why is it that we do not integrate the treatment management programs with, say, cognitive psychology in it? It really helps, because the minute we say disease, that very minute the well-being aspect gets hurt, and that needs to be taken into it, because the adolescents who are fighting with this problem, they start also having self-esteem and other problems simultaneously, which begins the secondary and the tertiary.
We are almost out of time. Any question?
Doctors do not. Why is it that we do not refer patients or integrate the treatment programs with clinical psychology?
Okay, so all of us agree on the panel that psychology should be a part of obesity management. That's why we've got a psychoanalyst on the panel.
We do not do it.
Okay, the last question. I've just got the last question. I'm going to take this paragraph. I'm sorry, we're really running out of time. Just like in obesity, we run out of options. We've run out of time for questions. Yeah. Just the last question, please.
I'm S.N. Bhargav. My question to Dr. Anjali, you said about the homemade ghee.
Yes.
Now, in olden days and even now, with ghee we put hing as a tadka or chong. Now, that was an antidote for cholesterol problems.
Okay.
Now, similarly, maybe others. Now, my question is two. One is that whether we can make aware by make advertisements in the cinema halls, etc., about these things you talked. And secondly, is there any study that with the same taste you can get less calories or less harmful fat?
Plenty. One is working on recipes constantly to create, tastier food. We've done a lot of programs on that. And your second thing, one writes articles to create awareness, not really in cinema halls, but we write articles in magazines and newspapers to create health awareness, so that all of this is written in articles about haldi, alsi, everything.
So I think we've run out of all time. So what we need to take home from here is that obesity is a disease. It is a lifelong disease. It causes a host of health problems.
You might see it that way. I really don't see it that way, but go ahead.
So we
you
disagree.
Can't say we.
Okay, so you need a psychoanalyst to eventually give the last word. Thank you, Susie Auerbach. Thank you, Anjali, and thank you, Dr. Arya Sharma.
Thank you very much, Dr. Lakdawala, and to our entire panel. May I request Ms. Sanchita Sharma, Health Editor, Hindustan Times, to please present mementos to Dr. Sharma, Dr. Mukherjee, and Dr. Auerbach.